Nothing is free even in Freetown, so the saying goes. However, in its continuous quest to offer humanitarian services to members, Foursquare Gospel Church, Asokoro, and Glorious Church, New York, USA, in partnership with the Christian Medical and Dental Association, have put together a free medical outreach for members of the ministry in Abuja and its environs to benefit from absolutely free medical services. Clearview TV was at the venue of the program and filed in this report.
The senior pastor of the Foursquare Gospel Church, Asokoro, Abuja, Pastor Oluwodola Babajide, and the lead pastor of Glorious Church, New York, USA, who is a partner in the free medical outreach program, Dr. Omotaya Oreduru, disclosed that the program was a way of meeting the health need of the less privileged and a way of giving back to the society.
As a matter of fact, the name of the game is don't be sick in Nigeria. Yeah. If you are sick here, you're as good as dead. So we know that the burden is heavy on the men and women in the lower run of society who cannot make ends meet. They cannot even feed. Talk more of taking care of their health. Many of them have been carrying diseases around that are absolutely preventable. And that's why we thought we should reach out to our immediate community. And as a social, as our own corporate social responsibility, to give them, make them feel our presence, make them feel that we care, lend a helping hand.
The challenge was that why are you doing this in a foreign country and you are not doing it in your country? And we've been doing this now in Nigeria for 3 years. The first one starting in 2019, and we had another one last year shortly before the pandemic, and we thank God that we have been able to do that again this year. The whole idea is to be a blessing. The whole idea is to use this medical mission as a tool for bringing the love of God, for showing the love of Jesus, and really bringing good news to people who are unable to afford these services for themselves. And by the way, everything that we're doing is totally free. We give out free glasses.
Dr. Motaya called on churches and spirited individuals to complement government effort in helping others, as government cannot do it alone. The mission director, Dr. Arthur Chibuzo, listed among others the areas in which the free medical services are to cover, which includes surgical, optical, dental, and general medical checkups.
We are running a medical outreach, which comprises medical, surgical, though we stamp that now. Then we are doing dental and optical. We started actually with optical outreach, and then we have moved to medical and dental now.
In an interview with the doctors in charge of the various ailments, the treatments are free in all their stages and the turnout is high. There is, however, a call for more helping hands, as there is a shortfall in resource persons to match the strength of patients.
This is the second edition of the program, and really it's really beneficial. It's absolutely and completely free.
We attended like 178 people yesterday.
So far it's been good. We attended to quite a lot of patients yesterday, both on the strictly medical consultation and quite a number that had to do some dental procedures. So the dentists are working on them, and this morning we've returned to continue the work.
This is free service, and the difficulties we have actually been facing is about what I have noticed. I told you I'm a volunteer. Is medical hands. You know, for this sort of thing, we need a lot of We need a lot of doctors, both the opticians, the dentists, the medical doctors. But there has been a shortfall.
Yes, I came for treatment, a general body check.
The free medical outreach program by the church has been on for some years now. This year's edition began on the 24th of May 2021, and it is expected to come to an end on May 28, 2021. It covers 4 square churches in Asokoro, Karu, Kurudu, Katampe, Durumi, and the Gakuchi areas of the FCT.
Well, we've had many of them in the row. Locally, I think this is the fourth. We've had international medical outreaches to other countries. Well, as you know, is capital intensive, both for personnel, for medicaments, for medicines, for all of those supplies, all those consumables. Yes, we are running this outreach with a church in Albany, Albany, New York. That is the Glorious Church. And we've been in partnership with them for a while. And we have local pharmaceutical companies that are also assisting us to cushion the harsh effect of the cost of the outreach. Yes. It's in several millions. It's in several millions because we buy the medicines, we buy, and we pay our volunteers. They are volunteers. We don't pay them a living wage, but we give them something that is worthwhile for their time. And as a social, as our own corporate social responsibility, to give them, make them feel our presence, make them feel that we care, lend a helping hand to the downtrodden, and give them hope, some hope that it is not altogether lost. Our nation may be in the throes of decay, but in it we can rise from the ashes and give as much hope as the Lord will enable us to these people in our various communities. We're reaching about 4,000 people in all our locations in the Abuja area, and we're grateful to God for the opportunity that we have to, so all our neighbors can feel our impact and know that it's not just go and be warm, but that we're ministering to their physical, mental, emotional, and social needs. Well, as you remarked earlier on, it's capital intensive. So it requires good planning in collaboration with our partners overseas. So it does take time. We should have done this outreach in February, but because of the COVID-19 pandemic, it slowed us down, and that's why we're doing it a bit late in the year. So we look forward to hosting another outing sometime next year. It may not quite be up to a year, but barring any challenges that COVID may still want to put on our way, we think in less than a year we should be having another anniversary. We want to build hospitals, want to build roads, want to build schools, we want to build bridges, we want to build schools for our missionary communities in the fullness of time. Well, we're reinventing the wheel.
In Abuja, Organic Victor reporting for Clearview Television.